What's the best way to tie in a chest tube? This is a question that comes up repeatedly. There is a variety of ways, and undoubtedly you will encounter individuals who are convinced that their way is the right and true way, and any other way is doing it wrong. I think that fundamentally you have to accomplish two goals when you tie in a chest tube. One, you need to close the incision around the tube to be reasonably airtight, and two, you need to secure the tube to the patient so that it will not come out before it's time to remove it. In my eyes, any method that achieves both of these goals is a perfectly good way to tie in the tube. Let me show you the way that I like to do it. I'm throwing a simple interrupted suture in the incision on one side of the tube and leaving both ends long. Take one of the ends and wrap it several times around the tube. Snug down all the wraps close to the skin, and then just tie this together with the other end. The multiple wraps is key to getting a good hold. Okay, now I'll basically repeat this same process on the other side of the tube. With this second simple interrupted, I'm going to try to close the incision tighter around the tube, and then one of the ends wraps round and around 4 or 5 times is enough. You could wrap both of the strands around the tube in opposite directions. Some people do it that way, and you probably get slightly more hold, but honestly I don't think it's necessary. This is going to hold really nicely, especially since we're basically doing it twice with one suture on each side. Tie it off, voila. Not going anywhere. Do you really have to tie so tightly that your knot is visibly indenting the tube? With this method, not really actually. The way this works with the multiple wraps, the knot is actually self-tightening around the tube when you pull on the tube. This phenomenon is also utilized in a variety of friction hitch knots used in rock climbing and nautical applications. For example, here's one called the prusik knot. You can see how it also has these multiple wraps dressed closely together, and when you put load on the line, it grips very strongly. It's the same general principle as what we just did. I should mention I'm not a huge fan of the traditional Roman sandal method that I think a lot of people have been taught. This one has a tendency to loosen up and then the tube can slide out. You get a lot better hold on the tube if you snug all your wraps together right down by the skin instead of lacing them some length down the tube. If you want to get a little fancier with it, you can tie the tube in starting with a horizontal mattress around the tube instead of the two simple interrupteds. This will help with sealing the incision nice and tight around the tube. There's also ways to do this where this same suture can be used to close the wound at the time of tube removal later on. That's kind of a nice perk, but I don't think this level of finesse is strictly necessary, especially during a situation like a trauma resuscitation where I think there's real value to the speed and simplicity of the first method I demonstrated. Hope you find this useful. Thanks for watching.